Medicaid and extra help. So, we're going to talk today about Medicaid and the extra help program. And we're going to be talking about Ohio Medicaid and the Ohio Next Generation MyCare plan. So, Medicaid is obviously run by the state. So, we can only really, in this video, talk about one state's numbers, and that's going to be Ohio for the purpose of this training today. So, let's go ahead and jump into it. Now, for whatever reasons, agents and prospects alike, they get Medicare and Medicaid confused with one another. And I just think it's because they have similar names, which is a little bit of a different ending. So, Medicare itself, now this is a federal program, and this is for people age 65 and older. This is basically national health care in America for people 65 and older, or people who have certain disabilities. Medicaid is for people of all ages, families, individuals, even children, and it's solely based on how much money you make and how much you have in assets. So something changes when you are on Medicare. So before you go on Medicare, if you have Medicaid, those income and asset limits are much higher. Because once you enroll in Medicare, one of the things that happens to our prospects is those income and asset limits go down. So there are a number of people that are on Medicaid prior to Medicare. Then they enroll in Medicare and they think, well, my Medicaid will remain the same, and that is not the case. Many people lose Medicaid altogether once they enroll in Medicare. So it's important for us, before we enroll somebody into a Medicare plan or somebody that's coming into our office that says they're turning 65 soon and going on Medicare, if they have Medicaid, we need to discuss with them the risk of losing their Medicaid. And therefore, we have a document that you can download from our website at resourcemedicare.com. So you can find this in Boost. It's going to go through the different Medicaid levels of what full Medicaid is, qualified Medicare beneficiary or QMB, SLMB, QI, and QW or QDWI. So we're going to go through these income and asset lists individually, but if you want to download the document from our website, again, it's resourcemedicare.com, and you should be carrying this with you at all times if you don't have internet access. Now, when somebody has Medicare and Medicaid, we refer to that as a person who is dual eligible. Okay, dual meaning two. That means they have Medicare as a primary insurance or something relevant to Medicare, like a Medicare Advantage plan, and they have Medicaid, which is in that secondary position. So before the implementation of the MyCare Ohio program, this is what it looked like, or before basically Medicare Advantage plans were even invented altogether. You had a primary and a secondary insurance. Now, depending on your level of Medicaid, this will look a lot like a Medicare supplement, the insurance we sell people. So it will interact with Medicare in the same way. It'll always be in that secondary position, okay? Medicare will pay first, and it only pays 80%, and the secondary pays the other 20%. Now, this only applies to people with full benefit dual eligibility, any level of QMB, and SLMB plus, because regular SLMBs don't have a card and therefore don't have a secondary payer. So this is just a concept to help us understand how primary and secondary insurances work. So Medicaid is very similar to what a Medicare supplement does, at least a Plan F, which we don't even really sell anymore, because it also pays the Medicare A deductible and the Part B deductible. Okay, again, that's for certain levels of Medicaid. So let's look at this level of Medicaid, which we call full benefit dual eligible. Now, what this level of Medicaid does is it will pay the Part A deductible, the B deductible, even the Part B premium, and all the 20% that Medicare doesn't pay. Medicaid will pick that up. It even gives you some extra benefits that, say, QMB Medicaid won't provide, like some vision and dental, but it's very, very limited. Now, Your income for this is $9.94 a month if you're an individual, and if you filed a joint return or you have somebody else in your household, and it's household income, we're looking at $1,491 a month. Now, the next level of Medicaid down, and it looks very similar to full Medicaid, is what we call QMB. Now, QMB stands for Qualified Medicare Beneficiary, and it'll actually say that on their card. It does everything that full Medicaid does, but it just doesn't give you some of those extra things, and those are limited anyway. Now, your income to qualify for QMB, you can make a little bit more money as an individual, and it's $1,350 a month. And for a couple, it's $1,824 a month. So the only thing you lose here, as opposed to full Medicaid, is just some of those extra benefits. Now, the next level down here that we're going to talk about today is called SLMB Medicaid. Now, this level of Medicaid only does one thing. It will only pay the Medicare Part B premium. In fact, these folks, they don't even have a card at all. Many folks with SLMB Medicaid don't even know that they're on Medicaid because they don't have a card. They just don't get that deduction out of their Social Security check to pay for Medicare itself. And over the years, if they remain on SLMB Medicaid, they forget that had a premium altogether. So if you ask somebody if they have Medicaid and they say no, and you later on find out that they did because they're not paying their Part B premium, that is probably the reason why. They simply didn't know. So if we want to know if somebody has this level of Medicaid and we're talking to a prospect, we probably need to ask the question differently. And I would ask it like this: do you still pay that Medicare amount directly out of your Social Security check? Now, most people will be attuned to this, or it will spark something in their memory, and they'll say something along the lines of, oh yeah, I think we took care of that a few years ago. Now, the income requirements are $1,616 a month as an individual, and a lot more for a couple, $2,184. All right, now one of the other things that's going to happen to somebody that is on Medicaid prior to going on Medicare is people on Medicaid that aren't age 65 yet. Medicaid pays for their prescription drugs. Well, once they become Medicare eligible, that ship sailed. It's gone. They must enroll in a Medicare Part D program because now they're on Medicare. So Medicaid no longer pays for their prescriptions. And so that means they must enroll in some sort of a Medicare drug program. Now, they can do that on an individual, like a PDP, just a standalone prescription drug program, or they can enroll in a Medicare Advantage plan, which we're going to get to in just a few minutes. Now, what adds an extra layer of confusion is once somebody's on a Medicare drug program and they're Medicaid eligible, they will almost always qualify for the Medicare Extra Help program, which doesn't come through Medicare, it doesn't come through Medicaid, and it doesn't come through their drug program. It is a separate program offered through Social Security to help subsidize that Medicare Part D program. And that's what we'll talk about next. So the Medicare Extra Help program, this is oftentimes confused with Medicaid. It is not Medicaid. Okay, this only is for people on a Medicare Part D program that qualify. It just subsidizes the Part D program only. And you don't have to have Medicaid to qualify for this. Okay, there is a big difference between Medicaid and the Medicare Savings Program and the Extra Help Program. Medicaid, again, is for people on Medicare who need assistance with medical cost sharing. Okay, so it's going to help pay the co-pays of an Advantage plan or pay the 20% that Medicare doesn't pay, or in some cases, just pay the Part B premium. The Extra Help Program, on the other hand, is simply offered for prescription drug help only, regardless of whether you're on Medicaid or not. And that is also offered by the federal government, where, again, Medicaid is offered by the state. So it is completely possible to qualify for the Extra Help Program and not financially qualify for Medicaid. And because people mix these programs up, they think if they don't qualify for Medicaid, that they also will not qualify for the Extra Help program, because oftentimes they think it's the same thing. Again, completely different. And I want to show you everything there is to know about the Extra Help program, because this is one of the most amazing things you can do for a client. Now, who qualifies for this Extra Help program? Again, we're moving away from Medicaid now. We're just talking about normal people. Normal people, 1 in 4 on Medicare, currently qualify for the Medicare Extra Help program for prescription drugs, but they've never applied. Why? They simply don't know about it. This is why it's important that we insurance agents can add this extra layer of help for people that don't have Medicaid. Okay? Now, this is what the Medicare drug program in 2026, this is the structure of it. Okay? This is without extra help. So you got a deductible phase where the private insurance company can charge you up to $615 of a deductible. Some do and some don't, and some are somewhere in between. Then you hit your stage 2, where in general you're paying 25 cents of every dollar until you have spent $2,100 total, and that can include what you spent in the deductible phase. And once you've spent $2,100, then you enter the catastrophic phase and you don't pay anything for drugs. Now again, this is without extra help. So what's it look like with extra help? Well, your monthly premium, if you're on a standalone Medicare drug program or an Advantage plan that has a premium, if it is a benchmark plan, that premium will go to zero. Okay? If it's not a benchmark plan, it'll probably go down in price, but it just won't go to zero. Now, your deductible phase will always go to zero, so you zip right to stage 2. But instead of paying 25 cents of every dollar in phase 2 or stage 2 of the Part D program, depending on your level of extra help, you're going to pay, in some cases, nothing if the drug costs nothing. Sometimes it doesn't. Or $1.60 to $5.10 for generics and $4.90 to $12.65 for brands. Where you'll land in there, which is less than the 25%, depends on the level of extra help you get. Okay? And of course, the catastrophic stage stays the same. Now, it's still really kind of hard to see where the extra help is going to help you. So let me show you a real world example of what I did yesterday. I pulled a drug list from a client, and this client's drug list looked just like this in 2026. Now, you can look at all the drugs. Many of the drugs without extra help already were $0. That's just what this particular Advantage plan offered. They still have the $2,100 limit, but they got a couple of drugs near the bottom of this list that hit the deductible, and they've got one that's didn't hit the deductible that's just really expensive called Ozempic. Okay? It's $243. So what I did is I went into the quoting and enrollment tool and I added extra help to see what would be the difference. And this is what it came up with. So instead of paying $477 a month for drugs until you hit the $2,100, now with extra help, they're simply paying $27, almost $28 a month until they reach $140, and that's their annual cost for the whole year. So you got a program that went from $2,100 in drug costs all the way down for the whole year, all the way down to $140. All the drugs that were zero remain zero, but now those drugs that were marked with the red around them are now significantly less money. Notice Ozempic there went from $243 to only $12. And then once that person hits $140 of annual drug costs, then they don't pay for drugs for the rest of the year. So this is huge when it comes to drug costs. When you help people get this subsidy that don't have it, it significantly changes their bottom line. In a lot of cases, it can save thousands of dollars a year. And again, 1 in 4 qualify and they've never applied. Now, the other cool thing about the Extra Help program is it will create a special enrollment period. So if you got somebody that's struggling and they're in lock-in and they don't know how to get out of their Medicare plan, you can ask them some income questions and create a special enrollment period for them to change plans in the middle of the year. Okay, it's SEP dual LIS change in status. This is an enrollment period we've used forever for people with Medicaid, but it's the same enrollment period we use for people that qualify for the extra help program that either brand new qualified or they've had a change in status, maybe a change in level, or they lost it altogether. Okay, that also creates a special enrollment period. Okay, now here's the income requirements for the extra help program. So somebody that's single can make several $100s more a month than even the lowest level of Medicaid. Okay, almost $2,000 a month, and their assets double. And for a married couple, it's $2,705 they can make a month in income, and their assets also double the lowest level of Medicaid, which is $36,100 in assets. So you may say, what are assets? It's things like your bank account, stocks, bonds, mutual funds, 401k pensions, real estate investments. It'll ask you on the application, which I'm going to show you here in just a minute. So how do you apply for the extra help program? Now, unlike Medicaid, that we can't help people apply for as insurance agents, we can help them apply for the extra help program. Okay? And the website to do that is socialsecurity.gov. You don't go anywhere other than there. Okay? Now, on the socialsecurity.gov website, ssa.gov, they've got a little Medicare tab. We're used to helping people apply for Medicare, okay? But you look at the fourth little tab down there under the Medicare tab, and you can see it says apply for extra help. You click that, and then you click the button that says apply online. And within 10 days, if they qualify and they are awarded it, they will get a letter in the mail. It takes about 10 working days after you apply, so relatively quick. This is what the letter looks like. Now, sometimes they're not white, sometimes they're a different color, but what you are looking for from your prospect is the word notice of award highlighted at the top of the letter. And that letter will indicate how big their subsidy is, and this is the very letter that allows you to open up a special enrollment period. Now, almost everybody who qualifies for Medicaid, this is already done for them, okay? Have I seen a few slip through the cracks through the years? Yes, but it's a pretty good statement to say if they have Medicaid, this will already be done for them. You won't have to do it. Now, so what happens if you have somebody that doesn't have Medicaid that qualifies for extra help, and when you were in that application for extra help on the ssa.gov website, you discovered that, wow, they make so little money, they might qualify for Medicaid too. There is a button, a little checkbox in the application, which is super short, that will allow that financial information to get sent over to the state, and then Medicaid will call them and start the process. So if you got somebody that you think qualifies for Medicaid and you don't have the ability to sign them up, you can go to the Extra Help application for prescription drugs, click that box, and then Medicaid will reach out to them, and then they can start the process from there. So one of the most important things we need to know for people on Medicare who are dual eligible or have dual eligibility and they qualify for Medicaid is what happens to this primary insurance. So what we need to know as insurance pros is that when we enroll somebody into a Medicare Advantage plan, what happens is that Medicare Advantage plan takes the position of Medicare. Their Medicaid remains in place in the secondary position, okay? So when we replace Medicare with a Medicare Advantage plan, we know that they're now going to have a network of providers, which we do a good job of looking up doctors. Their Part D program will come through the Medicare Advantage plan. And of course, a lot of times they do it for those extra benefits. Okay. So this is what's called a non-integrated setup, meaning there's still two insurances here. There's a primary and a secondary. And if Medicaid is their secondary because they're in a non-integrated setup, that Medicaid can also be privatized. not by us, but maybe they went into the MyCare Ohio plan where just the Medicaid portion is privatized, meaning now you're going to have two networks to deal with. Okay? So this is what non integrated looks like. And this is what we have been enrolling people in for years. Now, what's changed in 2026 is now we have these fully integrated dual eligible plans where the Medicare portion and the Medicaid portion now truly are one plan. And the only folks, at least in Ohio, that qualify for this, they must have full benefit dual eligibility, full Medicaid qualification, QMB plus or SLMB plus. Okay, QMBs alone do not qualify for this type of plan. Okay, and so this was done under the MyCare Ohio name. These are now called the Next Generation MyCare Ohio plans. And we have not been able to sell these in the past, and now we can. Okay, we have a couple of carriers that we can do this through. So the implementation of this has already started. For instance, January of 2026, those counties in the gray at the top right of your screen have already implemented this, and it is an eligible program for them to enroll in. Okay, now in April, you have some new counties that are going to have these plans available to them. And then so goes for May. You got different programs, those those northern counties like Miami County in Ohio, and then they follow suit. June, different counties, July, different counties, and then you get to August, and by August, the whole 88 counties of Ohio has been implemented. Now, what happens with these folks in the MyCare Ohio program that have that sort of Medicaid eligibility, they have year-round enrollment in one of the four carriers. Now, it's important to know also that those carriers, depending on where you live, will depend on what carriers are available to you. So like in the Dayton and Cincinnati area, those four carriers are the ones that are available to them. However, if you lived in Northeast Ohio, those carriers could be different insurance companies. So we don't really need to worry about that because we have quoting and enrollment software that helps us understand what plans are available in what counties. Okay. Now, one of the ones we've sold a lot of since this new program began a few months ago is the Anthem MyCare Ohio plan. Okay. It's one card, one claim, one network. This is really good for people. So now we're not dealing with two different networks anymore. Okay? The Medicare, the Medicaid both get privatized under one insurance company's name. The prescriptions and all those extra benefits go through that one card. And of course, they will not pay copays for anything other than small copays for prescription drugs. Okay? Now, you can identify these in your quoting and enrollment tool by looking closely. So I have outlined in red here how you know the difference between an Anthem dual plan that isn't fully integrated and one that is. So one that's fully integrated will have the MyCare Ohio logo on it. It'll say MyCare Ohio on it, and it'll even tell you which levels of Medicaid qualify for that plan. Because for instance, if you had somebody with just QMB Medicaid, your app will get denied because that's not a high enough level of Medicaid for this particular plan, so on and so forth. Okay, so the ones we have locally here, at least in the greater Dayton, Ohio area, is CareSource, Anthem, Molina, and Buckeye. And we haven't really sold many Molinas or Buckeyes, but we've done a more Anthem than we have CareSource. And that all has to do with network and what those extra benefits look like. Now, to qualify for the MyCare Ohio Next Generation plan, they have to have A and B Medicare. Okay, they have to live in the service area. And remember, the service areas are being implemented by months, which is a slide I just showed you. So by time we get to July, it looks like all 88 counties will be implemented, and they have to have full Medicaid. Full Medicaid means full benefit dual eligible, QMB plus or SLMB plus. And the one that we really weren't told about was you can't have a Dodd waiver. Now, we didn't know, we never even heard the term Dodd waiver until we got to 2026 when some of our enrollments got denied. And we were asking, well, wait a minute, these people had full Medicaid. We verified it. They lived in this. We went through all the qualifications, and then we were told, well, they had a Dodd waiver, and people with Dodd waivers cannot enroll in this MyCare Ohio plan. Okay, so what's Dodd stand for? It's Department of Developmental Disabilities. Now, this organization helps people that have severe problems. They need acute care, and it's normally full-time. You're talking about a nursing home level of care. Okay? Now, these are folks that generally will be institutionalized. That's one way that you'll be able to identify them, because you may not be able to just ask them if they have a Dodd waiver, but what we're looking for are people with certain disabilities, autism, cerebral palsy, epilepsy, they would be severely limited physically. They might even be in a wheelchair or have some kind of walking device, and they're going to have a full-time caretaker. That is going to be an indication of somebody that would have a Dodd waiver. So if they meet all the other eligibility requirements but have a Dodd waiver, it is a no-go. So what happens if you have somebody that has full benefit dual eligibility but has a Dodd waiver? What does that mean for them? If they want to enroll in a dual eligible plan, well, there is a whole host of other non-integrated dual eligible plans that will still be a good fit for those folks with Dodd waivers. And here's a couple in the greater Dayton, Ohio area. And when you go through these plans and you're quoting an enrollment tool, you're going to find that, the plans are literally identical. They don't have premiums, you don't pay deductibles, and you don't pay co-pays for anything other than maybe prescription drugs. And that's a maybe, okay? What does make them different are, what are the network of doctors? Because Aetna has a different network than Humana, which has a different network than United, and there's many others, okay? But the big difference, aside from network and what they'll pay for drugs, is those extra benefits. This is the key ingredient of why people want to switch to different dual eligible plans, okay? So it's the dental coverage, the vision coverage, hearing coverage. A lot of folks love that over-the-counter benefit. It's how many trips of transportation. There's various other extra benefits. Chiropractic care. That is where the dual eligible plans will be different, okay? So when you're quoting these, you literally, because the plans don't have premiums, they don't have deductibles, you're literally looking at drug costs, network, and extra benefits, and that's about the sum of it, okay? Just to help you out. All right, so because these plans look similar, a lot of people get confused. And the other thing that's changed in 2026 is if you're enrolling somebody in a non-integrated dual eligible plan, which is the majority of the dual eligible plans, we no longer have that quarterly special enrollment period. The only time we can change people into a non-integrated dual eligible plan is they must have some change in status with their Medicaid to be able to do it, or the annual enrollment period. Only people that are enrolling in a fully integrated dual eligible plan will have a year-round enrollment. Okay? So here's a great question. When somebody has Medicaid, is it okay to enroll them into just a normal street-level Medicare Advantage plan? In other words, do you have to enroll somebody with Medicaid into a dual eligible plan? And the answer is no, you don't. We use dual eligibility for the enrollment period, but you do not have to only look at dual eligible plans. There are plenty of street-level plans that are interesting. And you may say, well, wait a minute, a street-level plan or just a normal Medicare Advantage plan for somebody that doesn't have Medicaid has copays. It is true. However, with them having Medicaid in that secondary position, it will pay the Medicare Advantage copays for them. Remember, it just takes the primary insurance position. So, for instance, you can enroll somebody in a zero premium, normal Medicare Advantage plan, let's just call it United Healthcare, and it will have copays. Okay? Even the dual eligible plans actually have 20% copays, but you don't see that when you quote it because the assumption is they have Medicaid and Medicaid will pay it. Okay? So you don't have to enroll somebody in a dual eligible plan that has Medicaid. You don't have to. You can look at other plans, and depending on their level of Medicaid, it will pay the copays of the primary insurance. But again, remember, this is non-integrated, meaning the Medicare portion and the Medicaid portion, two different entities, and can actually be two different insurance companies depending on where you live. Okay. So the next question is, how do we know what level of Medicaid somebody has? Asking your prospect, they probably won't know, and if they don't have a card or have anything on them to help you indicate what they have, then what you can do is do what I do, and most insurance companies, Anthem has a place you can go, and in this case, this is United Healthcare. You simply just go to Jarvis. And on Jarvis, when you first log in, you got this little tab up here that says Agent Support Center. You click that, and a click to chat can come up, okay? Or you can just call them. I get through relatively quickly by calling. I don't personally use the click to chat, but we have a lot of agents that love that click to chat. As soon as that opens up, it'll give you a button that says eligibility verification, and you're going to begin to chat with an agent right away, and they're going to ask you for social security numbers, zip codes, counties, that type of thing. And they can tell you just more than their Medicaid eligibility. They can also tell you their Medicare eligibility. So you can use this same tool, like if you have somebody that doesn't know their Medicare number or lost their Medicare card, or you don't know their effective dates, you can do all of these things by simply contacting the insurance company. And in this case, United Healthcare, they're going to ask you what plan you intend to enroll them in. You give them a plan because they can change later. It doesn't mean you have to do it. Doesn't mean you even have to do it through United Healthcare. You can enroll somebody in an Anthem plan. We are just trying to figure out, do they have Medicaid? What level? Do they have Medicare? What are their effective dates? So on and so forth. And this will help you indicate what level of Medicaid they have so that you don't accidentally enroll somebody in a dual eligible plan that they don't qualify for.